If you have had any kind of injury to the brain, you might have a hard time sleeping. After brain injury, a lot of people have a hard time sleeping. You might have more difficulty falling asleep, you might have difficulty staying asleep, maybe both. Well, not getting enough sleep makes life a lot more difficult. You can feel more fatigued during the day, you may not think as well, you may feel more depressed, you just can't do as much. So it really helps to try to improve sleep. Today I'll talk about some of the reasons that you might have difficulty sleeping after a brain injury and give you some tips for things that you can do to help and some people that you can see that might be able to help you. After injury, the brain may not work as well at telling the body to fall asleep. Medications may lead to difficulty sleeping. Daytime napping might make it more difficult to fall asleep. Pain can make sleep more difficult. A lack of exercise makes sleeping more difficult. Depression can make sleeping worse. Caffeine might keep you awake at night. So how can you improve your sleep? Well, sleep hygiene tactics can make a huge difference in sleep. And here's a few to think about. First of all, wake up and go to bed at the same time each day. This is super important for sleep. Try to get some exercise each day. Try to get some sunlight each day. Keep daytime naps to less than 30 minutes. Stop screen time a couple of hours before bed. Don't eat, read, work, or watch TV in bed. Use relaxation techniques like meditation or music. Avoid caffeine, nicotine, and alcohol for a few hours before bedtime. If you don't fall asleep in about 30 minutes, get out of bed and do something relaxing until you feel sleepy. So what are some sleep treatments that you might get? Well, first of all, treating depression or anxiety with counseling can help sleep. There's over-the-counter medications like melatonin that can help sleep. There are prescription medications that can help sleep. But try to avoid medicines that cause you to be drowsy during the day or thinking might be more difficult. So who can help you with sleep difficulties? Well, first of all, primary care doctors can help. They can give you some suggestions and maybe prescribe medications. Physiatrists are doctors specializing in physical medicine and rehabilitation. Many of these kind of doctors work with people with brain injury and can help guide you with fatigue management and sleep. And then there are sleep medicine doctors who specialize in sleep, and they can look at your sleeping difficulties to decide what's going on and also give you suggestions for improving. So just know that there are things that you can help to improve your sleep after a brain injury.